Hey everyone, and welcome back to my channel. Today we're going to be talking about what you can expect when you register to the emergency department. So the first thing you can expect to happen when you arrive to the ER is being greeted by a receptionist or a triage nurse. Primarily they're going to ask you about your chief complaint, what brought you in today, and you want to be sure to provide as much detail as possible. They might ask you how long this has been going on, what you've tried for it at home, and maybe rate it on a scale of 1 to 10. It might also ask you for some basic information such as your name, date of birth, address, and emergency contact. You will also be asked about your medical history, any medications you're on, and any allergies you might have. If your current condition isn't serious, they might also ask you about some insurance information. Now, one thing everyone always asks is, why do I have to wait so long in the ER? To be sure, ER times are longer than they should be. However, this is for a variety of reasons that we won't get into in this video. Just know that based on the acuity of your condition, you may be waiting more or less time depending on how busy the ER is that particular day. It's important that you're honest with your healthcare providers and triage nurses, and you provide as much accurate information as possible. While you are getting triaged, you'll likely get your vital signs checked. This can include things such as heart rate, blood pressure, respiratory rate, and oxygen saturation with your temperature. This is very important for us to know, as it usually means the difference between a stable and an unstable patient. You might not even realize that your vital signs are abnormal until you get to the ER, as most patients don't routinely check these at home. It's important to let us know if you're coming to the ER with a fever, that you've taken a dose of Tylenol, for example, before you came, as this might falsely lower your temperature. It's also important to let us know if you've missed any of your home medications. This might include blood pressure medications, heart rate medications, as this may explain grossly abnormal vital signs. I also want to stress to you guys that when you go to the ER, be honest. We see a lot of patients, and we know when someone is lying or exaggerating their symptoms so that they may skip the line, for example. We also don't want you to hold anything back. So if you are coming to the ER with weakness and it started 30 minutes ago, I want to know that. I want to know if this is a potential stroke alert or if this is something that's been going on for several months that I have some time to work up. It's common for people to be embarrassed and try to be the tough guy. I would urge you not to do this. If you're having chest pain, tell us you're having chest pain and let us take care of the rest. One thing I want to talk about in this video is ESI. So what is ESI? It stands for Emergency Severity Index. It's a score usually between 1 and 5 that tells us, the providers, how sick this patient might be. It also tells us about the stability of the patient. An ESI 1, for example, would be someone in cardiac arrest, while an ESI 5 would be a comfortable patient there for his medication refills. What does this mean to you as a patient? Well, really nothing, but it tells us, the emergency provider, how urgently we should be seeing this patient. It also tells the other nursing staff to maybe place this patient on a monitor and start some IV line and get some blood work, as this patient might be sicker than another one. After you've been seen and triaged, you can either expect to be brought back to an exam room or back to the waiting room until it is your turn to be seen. Either way, it's important to monitor your symptoms and tell somebody if your symptoms are changing, as sometimes patients can get sicker while waiting to be seen. Going to the ER can be very stressful and scary, but it doesn't have to be. Hope this video helps so that next time you check into the ER, you'll know what to expect. Feel free to follow my channel for more videos. I'm going to be talking about many more things, including common chief complaints such as chest pain, shortness of breath, home remedies you can try at home so you don't have to come to the ER, and other things that we might be doing for you during your ER stay. Like and subscribe for more. See you next time.